A very good evening to all of you. Today we are going to do dermatology, that is skin MCQ challenge. These are the most important questions in dermatology. Dermatology has a heavy weightage in the Neet PG and the NICT exam. About 10 to 15 questions appear from dermatology. So this is a quite an important subject. So let us begin with the first question. Fox Fordyce disease affects A. Sebaceous glands. B. Eccrine glands. C. Apocrine glands. D. Any gland. Well, this Fox Fordyce disease, it is also called apocrine miliaria, is a rare chronic inflammatory skin disorder affecting the apocrine glands. It presents with a pruritic papular eruption, primarily the area which is rich in apocrine glands, such as the axilla, areolae, and anogenital region. So the correct option here is C, apocrine glands. Which of the following is the most common form of malignant melanoma? A. Nodular. B. Superficial spreading. C. Acral lentiginous. D. Mucosal. The commonest type of melanoma is superficial spreading melanoma. The melanoma progresses through three phases: in situ, then radial growth, then vertical growth. So the correct answer here is B, superficial spreading melanoma. Lines of Blaschko are present. A. Lines along lymphatics. B. Lines along blood vessels. C. Lines along nerves. D. Lines of development. These lines of Blaschko are defined by a pattern determined by nevoid, representing non-random lines on human skin or mucosa. Blaschko lines or lines of Blaschko are thought to represent pathways of epidermal cell migration and proliferation during the development of fetus. The lines of Blaschko represent non-random developmental lines of skin, fundamentally differing from the system of dermatomes. They follow a V shape over the back and S shape. So the correct answer here is lines of development, D. Pemphigus vulgaris is characterized by all except A. Positive Nikolsky sign. B. Oral erosions. C. Subepidermal bulla. D. Zank smear shows acantholytic cells. So the correct answer here is C. Subepidermal bulla. Pemphigus vulgaris is an intraepidermal blistering disease. So the correct answer here is C. Subepidermal bulla. It is not subepidermal bulla, it is intraepidermal bulla. All are features of atopic dermatitis: A. Denny-Morgan fold, B. Hartog sign, C. Darrier sign, D. Hyperlinearity of palm. Except C. This Darrier sign is a change observed after stoking lesions on the skin of a person with systemic mastocytosis or urticaria pigmentosa. So the correct answer here is Darrier sign. Darrier sign. Koppner phenomenon is seen in A. Psoriasis, B. Lichen planus, D. Wart, C. Wart, D. All of the above. It is all of the above. Koppner phenomenon, also called as Koppner response or isomorphic response, is attributed to Heinrich Koppner, is the appearance of skin lesion on the lines of trauma. The Koppner phenomenon may result from either a linear exposure or irritation. Conditions demonstrating linear lesions after a linear exposure to causative agent include molluscum contagiosum, warts, and toxicodendron dermatitis. So the correct answer here is D, all of the above. Heliotrope sign is seen in A. Dermatomyositis. B. Scleroderma. C. Photodermatitis. D. Vitiligo. It is seen in dermatomyositis. Erythema is caused by A. Corynebacterium, B. Staphylococcus, C. Streptococcus, D. Herpes virus. It is Corynebacterium. Christmas tree appearance in skin is seen in A. Pityriasis rosea, Pityriasis rubra pilaris, C. Psoriasis, D. Vitiligo. It is Pityriasis rosea. Pamphylux affects A. Palm and sole, B. Groin, C. Scalp, D. Trunk. It is palm and sole. Please click the link in the description to join the 3-day ultimate Neet PG breakthrough blueprint. It is a revision masterclass covering all the 19 subjects in a holistic manner. HPV causes A. Condyloma lata, B. Condyloma acuminata, C. bubo, D. chancre. It is Condyloma lata. Nail pitting is seen in A. Paranoia, B. Ectodermal dysplasia, C. Alopecia areata, D. All of the above. It is all of the above. Nail pitting is seen in Paranoia, Alopecia areata, ectodermal dysplasia. Vitiligo is associated with the following: A. Addison's disease, Men's syndrome, pernicious anemia, Crohn's disease, except Crohn's disease. Hessian-based cells in epidermis are responsible for A. Touch, temperature, pressure, proprioception. It is responsible for touch. Apple jelly nodule is seen in A. Lupus vulgaris, B. Cutaneous anaphylaxis, C. Ectoderma erysipelas. It is lupus vulgaris. True about lesions of lichen planus. Polygonal violaceous papule affect skin and mucous membrane, pruritic, all of the above. It is all of the above. Color of tuberous sclerosis lesion on wood lamp examination: A. Bright green, B. Milky white, C. Golden yellow, D. Blue white. It is blue white. D. Alopecia areata is A. Autoimmune disorder, B. Allergic disorder, C. Anaphylactic disorder, bacterial infection. It is an autoimmune disorder. Whitefield ointment is 3% salicylic acid plus 6% benzoic acid. So correct option is A. Urinary retention early seen in pregnancy. We all know it is at 10 weeks. Spaghetti and meatball appearance is seen in tinea versicolor. Miliary arises from obstruction of A. Acrine sweat gland, B. Apocrine gland sweat gland, C. Sebaceous gland, D. Ectopic sebaceous gland. Acrine sweat. Black Petra is caused by Pitria horti. So correct answer here is A. Pitria horti. Onychomycosis is most commonly caused by A. Trichophyton rubrum, Trichophyton mentagrovix, Epidermophyton flocosum, D. Candida. It is Trichophyton rubrum. RAS test is used in A. Allergic dermatitis, B. Seborrheic dermatitis, C. Mycosis fungoides, D. Squamous cell carcinoma. It is allergic dermatitis. True about pemphigus vulgaris, subepidermal, autoimmune, Zanksmia shows acantholytic cells. It is intraepidermal, not subepidermal. So correct option here is A. A girl about to marry has comedone. Drug to treat such a case is A. Topical antibiotic, benzyl peroxide, retinoid, D. Estrogen. It is a retinoid. C. Correct answer is C. Retinoid. D. Pigmenting agent of choice in treatment of dermatological disorders. It is hydroxyquinone. Vitiligo is associated with the following, except Crohn's disease. Sex worker with discharging ulcer, gram-negative diplopia, growth on tear martin. Diagnosis is Neisseria gonorrhea, syphilis, C. LGB, D. Chancroitis, Neisseria gonorrhea. Lovey bond profile is seen in clubbing. C. Clubbing. Hanifin Rajke's diagnostic criteria for atopic dermatitis. Spongiosis involves A. Stratum basale, stratum carneum, stratum glandulosum, stratum spinosum, stratum spinosum. Chambers purpura are seen on A. Face, B. Feet, C. Chest, D. Arms. It is feet. Matchstick test is positive in A. Rhinophyma, rhinosporiosis, lupus vulgaris. It is lupus vulgaris. Warren-Roth sign is a feature of A. psoriasis, B. lichen planus, C. pityriasis rosea pemphigus. It is psoriasis. Volcanosine is seen in A. leprosy, B. leishmaniasis, C. vulpus vulgaris, D. It is seen in leishmaniasis.